Hey, welcome to episode 137 of Awkwardly Awesome Podcast. Today I'm so excited and honored because I get to ask a nurse a lot of questions and be th- thinking of your questions too, and leave them in the comments, please. But getting to spend an hour with a nurse is going to be so exciting. And she's not only a nurse, she's a dear friend of mine. We've known each other since college, which was a few years back. So without further ado, we'll be right back.
Today's guest, Rachel Lindquist.
Well, welcome back to Awkwardly Awesome Podcast. I'm still your host, Jason Freeman. And let me tell you a little bit about Rachel Lindquist. Rachel is a proud registered nurse at a hospital in British Columbia. She has been a bedside ward nurse. She then went back to school to get her high acuity certification. After that, she received her critical care certification. She now works in her hospital's cardiac department. She loves cooking, gardening, traveling, and playing fetch with her adorable Labradoodle Pippin. The views Rachel expresses during this podcast are hers and hers alone. They do not reflect the views of her employer. Please welcome to Awkwardly Awesome Podcast, Rachel Lindquist.
Hi, Jason.
Hi, Rachel. How are you?
Good. I'm good.
Good. Thanks for being here.
You're welcome. This is exciting.
So I often take my guests back to when they were 7 or 8. If I had known like the young Rachel and asked her what she wanted to do when she grew up, what would she have said?
Oh, I think we even had that conversation perhaps back in college. I had no idea. None. I think I might have given some kind of response about I want to be a teacher. I want to be maybe a translator or a diplomat. I had no idea. I was, yeah.
So translating and in diplomacy was kind of an interest of yours in college. You majored in
International studies and modern foreign language, with some idea that I wanted to travel. If I could have been paid to travel full time, that would have been amazing. But I'm a terrible writer, so I don't know.
Did you specialize in any one language in college?
German, and with a secondary focus in French. So that's how I ended up spending my junior year abroad in Germany, because the college that we went to had a relationship with this university in Germany. So I was able to pay my tuition to our college and attend that college in Germany, which was awesome.
I completely forgot that you had a secondary emphasis in French.
Yeah, but I hated it.
Why wasn't French your thing?
What's that?
Why wasn't French your thing?
I don't know. Somehow German appealed to me more. The idea of building words together to make these incredibly long super functional German nouns. It was very appealing. French just, I don't know. Everybody has a draw towards French. I just never saw it.
So you went to Germany your junior year.
Mhm.
Had you ever been out of the country before that point?
Um, I think no. I don't think so. I think that was my first trip. No, I'd been to Germany. I studied German in high school, and I'd been to Germany on an exchange program. We did like a pen pal kind of exchange where we were matched up with a school in Herglenshausen, which is a small sort of city in the Mosel Valley there. And so we went abroad. So our match pen pals came to Minnesota for a couple of weeks, and then we went abroad to visit them for a couple of weeks. So it was like that was my first trip abroad. I think that was my first flight, and it was super exciting. And I knew I loved languages. I knew I loved studying languages. So when I went to college, studying languages kind of made sense. I was always good at it. It came easy to me, generally. So I thought, well, maybe this is something to focus on.
What do you remember most about that trip in high school?
I left my passport on the plane in the
Oh.
little seat pocket
Oh.
like, you know, you're sitting in your seat and there's the little pocket in front of you and the seat back of the seat in front of you. And I left my passport in there because I tucked it in there thinking, oh, well, it'll be safe there. I won't lose it. And then I got off the plane and we got to immigration and I did not have my passport. And it was a whole thing. And I had to go back to the plane and they were cleaning it. And I was like crying and I was in tears. And I was like, I left my I think it's there. I'm not sure. And they were like, oh, well, what does it look like? And I described it. And then they pulled it out and said, oh, yeah, we found it.
Oh.
It was very stressful. And the entire group was waiting for me. I think there was, I don't remember how many of us there were. There was at least a dozen of us students, I think, and everybody was waiting for me. I was the only one. Anyways.
So and then you must have been so relieved.
I was very
First of all, you must have been so relieved when you got your passport.
Yeah, I was very relieved. I have lots of very good memories of attending school with my my pen pal buddy who I was visiting. I was attending their school and going to classes with them. We went to house parties and it was just really fun. It was really fun to get a little slice of life in another country for this little, you know, white Midwesterner. I'd never been abroad, and it was just kind of like, oh, this is so neat. There's different ways of doing things, different ways of seeing the world, different perspectives. It opened up everything.
Well, that it just sounds like such a great high school memory. That's so cool.
It was fun. It was fun.
And then in college, you didn't only go to Germany for a few weeks. You went for a whole year, right?
Yeah.
Whole academic year.
Yeah, a whole academic year. It was my whole junior year I spent living and going to school in Germany. Yeah.
How did that experience inform the rest of your life?
Well, it confirmed for me that I wanted to do something, hopefully that I could interact with people outside of the States. I didn't want to just live in my little city bubble, but I still didn't really know. I still didn't really know what I wanted to do. I just knew I really enjoyed living abroad.
And then after college, you went the other direction and spent how long in Japan?
Yeah, I was searching around for another place to go and visit and see if I could live abroad and try to get paid for it. So I joined up with the JET program, which is a program run by the Japanese government that brings people from English-speaking countries to Japan to teach in Japanese high schools, essentially. High schools, middle schools, elementary schools. But it's a program that the Japanese government supports with a lot of resources to try to bring the world to Japan and to their students at a young age, which I think is cool. So I joined up with the JET program and moved to Japan after graduation.
What was that experience like?
Oh, well, it was pretty amazing. It was pretty amazing. I really enjoyed it. I had a very good time. I met wonderful, wonderful people. My roommate in college, you remember, my roommate in college was Japanese, and she became a really good friend. And she said, "Oh, you're going to Japan? See if you can get stationed at a school that's near where my parents live. Maybe you could live with my parents." And I was like, "Oh my God, that's amazing." And also crazy. And it worked out. It worked out really beautifully. So I was able to get stationed at a school, at several schools that were right near where they lived. So I lived with her family for 3 years out of the 5 years I lived in Japan. Yeah, which was amazing. Her family is so awesome. They were so wonderful. They took me in and treated me like any one of their kids. And they were just really welcoming, really open. It was the most incredible experience. Yeah, it was really awesome. And then I ended up staying longer than 3 years. So I moved out into my own apartment and ended up staying for 5 years, almost 6 years, because I loved it so much. Yeah, it was fun.
Almost 6 years. That's really an immersion in another culture. I mean,
Yeah. Yeah, it was a really incredible experience. I'm so glad I had it. It's yeah, it was a long enough time to really to get to know the language, to get to know the culture and the people. It's a wonderful, wonderful country. Oh my goodness. It's I have nothing I mean, I have some mixed feelings when I look back maybe, but it was really a wonderful experience.
what do you miss most about Japan?
How polite everybody is and how thoughtful everybody is in terms of um, in terms of living so close together with so many people. If you can imagine, the entire population of Canada lives in Tokyo. Like it's I think I don't know what the numbers are currently, but 35 million people. I think the population of Canada is roughly 35 million, and I think the population of the greater Tokyo area is roughly 35 million. If you can imagine, I can't imagine that many Canadians living that close together in such a like it's so people would get so crazy. But somehow in Japan it works because there's a culture of be nice to your neighbor, be thoughtful about how you move in the city, how you interact with people, being welcoming to people, being considerate. It's like a culture of considerate behavior. If you have a cold, you wear a mask. You just do. If you have some garbage, you throw it away. Like you don't litter. You don't like. There's a whole. I could fall asleep on the train in Tokyo in a city of 35 million people, and my wallet and everything and my phone would still be there when I woke up. Like, what kind of city does that happen in? It's amazing.
I love that idea. How you describe it, a culture of considerate people.
Yeah. It's really I
Sounds
miss that. I miss that. It was really amazing. And you don't really appreciate it until you don't have it anymore.
now you live in Canada. How is Canada alike and different than the United?
I mean, there's more
Than
space.
living in the
You don't have
United States?
billions of people
What?
living on top of each other. There's more space. There's more room to move around. There's more parks and wide open spaces, trails. I have access to mountains and the beaches and everything, all just right here, which is so great. Yeah.
Is the culture of the Canada pretty much the same as the United States?
Um, Canada in general, this is hard because I'm going to get into things that are just my perspective and my experience, which wouldn't necessarily be reflected in everybody else's experience. But I live in an area that has a lot of immigration. A lot of immigrants have settled into the areas around where I live, and consequently, the city's cultural scene and foodie scene and everything is reflected in this diversity, which I love. I can't, I don't think I could be as happy in a city that was as homogeneous as some of the places that I've lived in the States.
Sweet, sweet. So you were undecided in terms of a career in college,
Mhm.
and then what led you to nursing?
The short story is that after I left Japan, I moved to Canada and needed a job. So after immigrating to Canada, I had all this experience teaching in Japan, and I decided I was burned out of teaching. I didn't want to teach anymore. As much as it allowed me to live overseas, it was not something I saw myself doing in the long term. So I got a job. One of my first jobs, not my first job, but one of my first jobs after moving to Canada was working in a doctor's office and working with doctors and nurses. I was the secretary, office assistant, one of a couple of office assistants in that office, and I worked there for I think 8 or 9 years. It was a long time, and many of the nurses kept telling me that I should go into nursing. I was really good with the patients who came in. I had an ability to make a good connection with people, to make them feel comfortable. They said, "You'd be a great nurse. Why don't you go to nursing school?" And that sort of put this idea in my head of, oh, maybe this is something. Maybe I should look into this, because I really enjoyed healthcare. I enjoyed helping people. And there's also a teaching aspect to it that was nice. So it was sort of a marriage of skills that I really liked about myself, my ability to talk to people, connect with people, and my interest in medical at that time, interest in the human body and sort of how it works and how amazing it is. And it all kind of came together. So then I applied for nursing school, and it was probably the hardest. It was easily the hardest thing I've ever done in my life. Yeah. I shouldn't say probably. It was easily the hardest thing I've ever done in my life.
Did you expect the challenge of nursing school? Did people prepare you for that, or were you kind of surprised by how challenging it was?
I always found school challenging. I've never excelled at academics. Languages, I always did well in language programs and my language classes, because it made sense to me and came easy to me. But I didn't I always had difficulty in other academic classes. So I knew going back to school would be hard to get another bachelor's degree. I knew it would be difficult, which is probably why it took me 9 years of working at this office to work up the courage to apply and get accepted. It's probably why it took me so long, because I knew that would be difficult. I wasn't prepared for how difficult it would be. I kind of, yeah, going back to school after a long absence is tough. You have to remind yourself how to write a paper again, how to write an essay, how to study for exams. And once you get out of that mode, particularly when that mode was never a very easy fit anyway, it's hard to put it back. It's hard to like get back into it. It took me a while. Nursing school, though, in particular, is in particular, I think it's hard. It's harder than the degree I got when we were in college together. I don't know. I don't know if I could specifically say why it was so much tougher. They're trying to prepare you for a career in a job that's difficult to prepare for. You have to know all the medical. You have to know all the things about the body and the systems and illness and everything, and about how it all fits together. But you also have to know the soft skills of being able to connect with somebody, being able to empathize with somebody, being able to sit with them in what is probably the worst time in their life. And those are all things that are difficult to teach, difficult to learn. It's a difficult a degree to figure out, I think, how to teach it and how to evaluate it. I think the teachers have a difficult time evaluating those skills. Either you have them in some cases or you don't. And it's hard to demonstrate them in writing a paper or in taking an exam. It's just, I don't know.
What helped you the most, do you think, in learning the soft skills?
I think in my case, I had the soft skills I had a good foundation in the soft skills going into it because of my travels, because of living overseas, meeting so many people and teaching for so long. I think I already had some grasp of the soft skills. So those weren't perhaps so difficult. I think for me, the exams were difficult. The memorization was difficult.
What would you say to like a college student listening to this who wants to go into healthcare but who is worried that the soft skills don't come naturally to them yet?
I think soft skills come with age. I think they come with experience. So if you're 20 years old, going to school, going into nursing or whatever career it is, your soft skills are going to develop. And a teacher that tells you that they're not is not a great teacher, in my opinion. I think that they're just going to come with time. And that's not a very good answer. It's something, you want to be able to learn it. You want to be able to do it correctly, but it just comes with time, I think. And you're going to grow just like any other career. You're going to grow as you go, and it's only going to help you.
But patience often is not the answer we want to hear, but
that's true.
But a lot of things do really take patience and take time. And
takes time. Yep. I started off in one area of nursing, working with the brain, and I switched to a completely different area, working with the heart. And they say that anytime you start in a new department like that and you make a new change like that, it takes easily 6 months to a full year before you feel confident in the new area of knowledge. And I think that's true. You just have to like get through it and persevere, get through the learning that you need, and understand that you're not going to be super knowledgeable or super confident for a good year before you feel comfortable again.
Speaking of getting through it and persevering, what kept you going in nursing school? It was hard. It was new.
It was my friends.
What kept you going?
It was my friends. Absolutely. I would not have finished, excuse me, I would not have finished the program without the people that I connected with. Other students like me who were going back to school for a second degree, mostly, we formed study groups and chat groups, and we shared information. And, oh, this teacher in this class shared this about the exam. Did you get that in your class? No. Oh, okay. And it was a collaboration of learning how to network, learning how to study as a group. We would have study sessions at my one friend's house. She would have us over every few weeks, and we would study and study and study and study. And if one person didn't understand it, or several didn't understand it, there was usually somebody in the group who did understand it, and they could explain it to everybody else. So it was sort of about working together with whatever your area is that you're comfortable with. And just, yeah, absolutely, the study groups, that they were critical.
That sounds so like such perfect preparation for your nursing career, because
it turns out that that's exactly what nursing is all about. It's exactly what it's about. You have coworkers who have different areas that they're good in or proficient in or understand better than you, and you go and ask them. Say, I have a patient that's, they're complaining of this, or they're reporting this kind of symptom. What do you think? What does this seem like it might be to you? Or what is it, something that you've done in the past that's worked? I have a patient who's reporting this amount of pain. I've given this amount of pain meds, and it doesn't seem to be working. Do you have any other ideas? It's exactly what nursing is like a lot of times. So in retrospect, they prepared us really well by forcing us to do the thing that we didn't know we needed to do to prepare ourselves for this career, if that makes sense. I think they probably knew that we were, of course they knew that we were forming study groups, of course. It's part of, I'm sure, what they wanted us to do. And it turns out to be a really good skill.
So then there's the academics and getting a nursing degree. And then what was it like going from the academic routine to doing your first clinical?
You have your head crammed with so much medical information, so much about anatomy and physiology and pharmacology and empathy and all of this kind of, difficult. I think I had a whole class about difficult conversations to, how to approach them, and all of the different sort of phrases you can use and that kind of a thing to sort of be with somebody who's in a very stressful time. And you have your head, all of this is crammed into your head. And then you graduate and you think, okay, this is going to be amazing. I'm going to be amazing. And it's just not like that. The moment you graduate, you start learning all of the things that you need to learn in order to continue in that career. And by that, I mean, school teaches you the textbook way of how to do something, how to approach something. There's a textbook right way with these many steps and all of this. And then when you get into practice, you realize that it's not really like that. There's nobody who's sitting there giving you 15 minutes to look up all of the information that you need and all of these steps. Like, you're not nursing just isn't like that. It doesn't follow a textbook because it's people. People don't follow a textbook. There's kind of a instruction manual for people, but not really. Not really. Like people are varied, and there's pain can present in 1,000 different ways, and you might know 999 of the ways, but one way you've never heard of. I didn't know that this could indicate pain. Like so you graduate and you start practicing and realize that there's so much more that you need to know. And initially it's frustrating. And then you sort of settle into, okay, well, there's a lot I still need to learn, and that's okay. And you sort of just persevere. And then I remember after, I think maybe a year and a half or so, the educator on my unit approaching me and saying, I think it's time for you to take on a preceptor student. And I thought, what? A preceptor student? I'm not ready to preceptor. Like, what? No, I'm still new. I'm new.
So what is it? What is a preceptor first?
So when you graduate nursing school, at the end, the last term essentially before graduation is a preceptorship. And it's kind of like an internship, like an unpaid internship, where it's part of your program, and you buddy with a preceptor who is a teacher who's working as a nurse, and you buddy with them for like an entire semester. So months and months and months. Sometimes it's only one teacher, and sometimes there's 2 or 3. It depends on how they divide it up. But you go to work with them. You follow their same schedule. You are buddied with them for every shift. And they teach you all of the things that you need to know, but not all of the things, because not all of the circumstances come up in those few months, right? But you start to have an understanding of, oh, there's way more to this job than I thought there was. So it sort of gives you an inkling, but essentially you're a teacher.
So suddenly the lead educator on your floor came up
and said, it's time for you to teach a student, a nursing student. And I thought,
and what went through your head when that happened?
I'm not ready. I still feel like I'm still a new graduate. I've only been doing this a year and a half. Like that seems bonkers that I'm ready to teach a student. And then I got matched up with and she said, no, it's fine. It'll be fine. I promise. And I said, okay. So I got matched up with a nursing student, and I started preceptoring and sort of mentoring them. And all of a sudden I realized how much I knew. They had questions and I knew the answers. And I thought, oh, this is nice. So there's sort of that kind of realization that you don't know how much you know until you start teaching somebody else. And then you
don't know how much you know until you start teaching someone else.
Mm-hmm.
Wow, it's a powerful phrase. So it sounds like that was a real confidence booster for you, huh?
Yeah. It was probably exactly what I needed to realize that I knew more than I thought. But you get to a place where you're just doing these things without realizing how far you've come.
So before we started recording, you mentioned that you had seen Dr. Ridgway's the interview I did with him, and you really liked the term. What was it? Partnering in care.
Partnering in care, yeah. That he used, that phrase is so important. It really resonated with me because it's exactly how I think it needs to be perceived. Not as somebody telling you what to do or ordering you around or anything. It's not adversarial. There's no power dynamic really. It should be approached more as your partners. You're partners in sort of getting onto whatever healthy road that you want to get onto. Yeah, and being a partner in care is yeah, it's really it's a really good way to describe it. The best.
So do patients sometimes feel like they're being bossed around?
I think that there's a feeling amongst patients that doctors don't always listen to them, or nurses don't always listen to them. Healthcare professionals, you go with a problem and, well, they didn't hear me, they didn't really listen to me, they didn't listen to my problem. I think that happens a lot, and I think it's unfortunate. There needs to be more of a, I'm there to listen, but I'm also there to help you. So it's sort of that it goes back to that partnership of, what did you come here for? What problem? What concern? How can I help you to address it? Yeah. And I think too, people have a perception of, well, I went for this problem and they told me to lose weight or something like that. But if that's not a realistic goal for you, or not something that, not a solution that you're looking for, it doesn't really help you at all. It doesn't help to go to a healthcare professional and be told to do something that's not realistic for you, or it's not attainable. It's not going to help you with your getting back on the road that you need to get onto.
What can patients do so they feel more heard? Do you?
Well, I think it's twofold. I think it's patients maybe changing their approach a little bit, but I think the bigger part of that equation is healthcare professionals, doctors and nurses, and all of the healthcare professionals in allied health changing their approach in how they approach a patient. And it shouldn't be from a place of, I know all the things, so I'm going to tell you what to do. It should be from a place of, I don't really know you. You're a stranger to me. Tell me what you need and tell me how I can help you, or tell me what you need and then let's talk about how I could help you.
And is there anything a patient could do to so the healthcare professionals would listen more to them?
It's it's sometimes I can tell you what I can tell you what would help me to take better care of a patient, or to work more closely with a patient.
Yeah, please.
It helps me when, as much as I love talking to people, as much as I love connecting with my patients, it helps me when you keep our conversations, if I'm very busy, to keep it focused on why you're here or what your concern is, instead of, I don't always have time to chat a lot. As much as I wish that I could, I don't always have time for it. So sometimes it's very difficult for me to focus on the things I need to focus on if you're telling me about things that are unrelated to why you're here.
This is a hard one because
It's hard.
Because people love to chat about stuff they love, and
sometimes it's helpful for people to ask why, because I don't always think to offer the why. I might say, I need you to lay flat here. Why? Why should I be laying flat? Why are you asking me to lay flat? I don't always think to offer the reason, even though there is a good reason. So sometimes it's helpful if you don't understand what they're asking you to do, or you don't want to do it, or whatever. It might be helpful to ask why. What happens if I do that? What happens if I don't do that? What happens if, XYZ? That makes sense?
That's powerful. How about like it's I hear this so much that patients will leave a doctor's office confused about a diagnosis or confused about a treatment plan or just not remembering some stuff. What can patients do so they get a more thorough information and either remember it or
You can
I don't know.
always ask as a patient if you've understood something correctly, and then paraphrase it back to the doctor or to whomever's talking to you. So if somebody has said a whole long list of things, and you as a patient are taking this all in but not really understanding it, you can always say, do I have this right? And then go on to sort of paraphrase what they've just told you. It's a good way of in any time, and active listening is sort of a good way, even in just conversations with friends or anything like that. But it's especially a good way in a doctor's appointment or healthcare setting to sort of see if you understand what's being told or what's being expressed to you.
That's a great idea. It slows the conversation down, and then I'm saying it back to you, so I'm remembering more of it because I'm hearing myself say it,
Mm-hmm.
and then the doctor and nurse can
Mm-hmm.
clarify if I misunderstood.
Exactly. And I also think and encourage people to bring another family member with them to have another set of ears in the room or in that moment or whatever. If there's somebody else that you trust to be there with you, that's always a good idea. Not 3 people or 4 people, you don't need to bring your mother's cousin's dog walker, but you could bring, maybe sister or brother or sibling or an adult child or spouse or whomever. And maybe then, you have an extra person there to be able to hear the critical stuff. In fact, in the department that I work now, before discharge, so it's a day procedure kind of a department. So we do day procedures. And before discharge, we have whoever's coming to pick up the person, we have them there with us when we give the discharge instructions. No exceptions. We don't give the discharge instructions to somebody and then say, goodbye, be on your way now. We have the person who's going to be escorting them home come in, and we give them all the discharge instructions together so that we know that the patient hears it and that their person going home with them hears it.
That makes so much sense.
Yeah, it's a really good idea.
This gets into you brought up family and friends and when a loved one's in the hospital, I think a good friend or something. Sometimes the instinct is to always be there. Visiting hours from 10 to 7 at night, so I'm going to stay the whole time. Is that practice always helpful for everyone involved?
It's helpful sometimes and not all the time. It's not always helpful. There are times when we need to focus on the patient. They are our primary focus. And if you are there distracting us, asking us a lot of questions at that time, then we're not focused on the person we should be focused on. So there's a time and a place, I think, like anything. First thing in the morning, when the nurses come on shift, is a bad time for visitors to be there. I'm coming on shift. I'm getting to know these patients. They're strangers to me. I've read all about them on paper. I'm trying to get to know them in person. And it's a bad time for me to be focused on other things. They should be my primary focus. At the end of shift, again, usually it's okay because I've already spent the day with them. I already should have a good idea. But I'm trying to get the end of shift. I'm busy. I'm trying to get all my shift work done, trying to get everything documented. I'm trying to get all the ins and outs calculated. And I'm trying to clear up any things that have been sort of held over from the day, making sure I've done all the tasks that I needed to. That's not a good time to be asking me this, and this, and all the other things. So yes, I'd love to have families visit, but there's a time and place.
And is it helpful?
I love it. I'm sorry. I just need to add this. I didn't mean to interrupt, but I love it when families call and say, hey, I'm thinking of coming to visit today. When would be a good time? It's amazing. I love that. And then I get the chance to say, you know what? After lunch is the perfect time. I usually don't have a lot of nursing care to do. Maybe the patient's taking a nap from this time to this time, perhaps. But if you wanted to visit a little bit later, you could have uninterrupted time to sit and chat with them. You're not going to interrupt me at all. And I'm sure they would love to have you visit. I love it when they call ahead. It's so great.
So calling ahead's a big deal.
It's really nice. It's really nice. Again, though, it's hard because people like to call right before the start of the day shift. 10 minutes before the start of the nursing shift is not the time to call. We're not going to pick up the phone because we're busy giving handover from our shift to the next oncoming shift. And that's a really important time. We give handover. It's critical that we're not distracted by phone calls at that time. So yes, call before you come, but try to avoid calling at shift changes. And you can just find out when the shift changes are on that unit in that hospital department pretty easily. And then just avoid sort of calling a half hour before and a half hour after. And then outside of that time, you should be good.
So how do we find out when shift changes are?
The best way to do it is to call middle of the day, or, if you want to go to the hospital to visit your family, go to the hospital and check in with the nursing station and ask them, when do the nurses change shifts? When is shift change? This time in the morning, and usually it's this time at night, and then or you can call in the afternoon. The afternoon is usually a really good time. Generally speaking, it's a good time because all the morning care has been done. And it's far enough away from the end of shift that things are usually sort of a little bit less chaotic. And it's always a good time to call or to visit and then just ask.
When we talked before, you said something that made a lot of sense about when a patient is in the hospital, it's the caregiver's time to kind of rest up and do other things. Can you say a little bit more about that?
I'm glad you reminded me. Yeah. A lot of people have this idea that when their family member is in the hospital, that they need to be there all the time for all the visiting hours when their family member is in the hospital. But actually, if you think about it, the time when your family member is going to need you the most is when they get discharged from the hospital. That's not to say you should not go visit them in the hospital. You should, but visit them in a more limited capacity, because this is the time that you need to use to get things done. Because once your family member gets home, you're on. That's it. You're the caregiver. And you're going to need to have all of the spoons in your drawer. Do you know that theory of you only have so many spoons in your drawer, which are like the energy that you have in the day? And you're going to need all of your spoons in the drawer once they get home. So when they're in the hospital, use that time to do the laundry, do some meal prep, do the errands that you need to do, look after the family members that you need to try to get things in order for when they come home.
That's such helpful advice for everybody, because then the patient can sleep more in the hospital, maybe.
Well, that's true too. Surgery, whatever surgery they're having, even if it's a minor procedure, it takes a lot out of you. It takes a lot out of everybody. Anesthesia, and there's, all kinds of things. And then we're giving medications for pain control and nausea control and everything like that. People are tired. The last thing I can imagine that a patient wants necessarily is to have the energy to visit with somebody or to feel obligated to visit with somebody in the immediate period following the surgery. They've had the surgery, they're in recovery. That's a time for them to rest. They need to rest from the ordeal of the surgery. So, if you're wanting to know how they did and how the surgery went, pop in for a visit, say a quick hello, 10 minutes, and then be on your way again to let them rest and recover.
These are such good tips that really could make a big difference for everything.
I'm so glad.
Another thing you mentioned just before we got on is that you enjoy building a trusting rapport with a patient in just a few minutes. So meeting new people is a big thing in any career, or even outside of careers. What tips do you have for developing trust with new people fairly quickly?
It's tricky. The older I get, the better I am at it, because the more experience I have to draw from to be able to connect with people. But I still wouldn't say I'm really great at it. I'm not going to connect with every demographic and every person and every time in their life. It just is what it is. But it's tough. You have somebody coming to you who's a total stranger to you that you need to trust you. I need them to trust me, to take care of them, to look after them in this vulnerable moment. So I need to establish a relationship of trust with them in an hour. Right now in my current department, I have maybe an hour with people before the procedure that they're in for. So I need to use that hour to ask them about their family. I usually ask them about pets or something like that. Where are they from? Have they had this procedure done before? What was their experience like before? What are they anxious about today? Those kinds of things. And then you listen. That's the most important thing. You ask them these questions and then you listen and you remember what they told you. So if they told you they're anxious about this particular thing, then you try and make sure you can do everything you can to minimize their anxiety about that particular thing. If they told you that they have a favorite this, that, or the other thing, then you can joke around with them about this, that, or the other thing, because you're establishing that you remember what they told you and that they're not a stranger to you anymore. They are a person that you are taking care of. And that's a much different thing.
In those kindnesses, I think they mean so much to patients.
I think so. I don't know. I hope so.
Coming full circle as we start to wrap up the interview. So you mentioned that where you are, there's a lot of people from foreign countries. So your experience traveling, how does it help you in your current career?
Um, Experience traveling is helpful in connecting with people from different cultures and different countries and different places, people who have other people who have traveled around the world, for sure, because they tell me they're, originally maybe from somewhere or they grew up somewhere. And I've visited that place and I think, oh, that's nice. Oh, yeah, I remember. I have really good memories of this place, and this place. And then they light up and they, oh, yeah, I've been those places. And it's sort of just whatever. It sort of allows me to get some perspective on their life and something that happened to them, and it's a good way to connect. Yeah, it's a good way to connect with people. Traveling, for sure. I speak a little bit of a couple of different languages. That's helpful too, because that can make people feel more comfortable. I wish I spoke other languages. I wish I spoke Mandarin, for example, or Cantonese or Punjabi, because those would be really, really helpful. But thankfully, we have other staff who speak those languages. So if somebody needs to be able to communicate in a different language, sometimes we have another staff member who can communicate with them, which is nice. And now we have a tool where we have a translator on an iPad, and we can dial in to somebody who speaks any language, almost any language. There's dozens and dozens on this iPad. So whatever language people speak, we can communicate with them, which is nice.
So you dial in and it's a live translator?
Yeah, it's great.
Wow, I bet that's a big deal.
Yeah, it's a big deal. We've only had it around. When I started nursing, we didn't have it, and now we do. So I've seen the addition of it, and it's just been in the last maybe 4 or 5 years, I think, that it's become commonplace for us to use it, and it's really nice. We can dial into a translator or an interpreter in audio only or with audio and video, so that we can video with them so they can see the patient and the patient can see them and they can see they're talking to a real person, which is really nice. It's really nice. Very helpful.
Wow, that's so cool.
Yeah.
So such a thank you for all you do. Being a nurse is what a great career.
Yeah, I kind of just fell into it, and it turns out to suit me really well. I really enjoy it. I like the teaching part of it. I like the connecting with people part of it. I like the skill part of it. It's never dull. Just never there's certain things that are routine, but never a dull day in any of the departments I've worked in. It's always interesting, which is fun.
Are any of the patients ever the same as one another? Are people pretty different?
And people are different. People are very different. Yeah, I don't think anybody's ever really the same. I mean, there are things that are routine. I think there's a routine to it. People coming in, perhaps, who have had this procedure or one of our procedures done before. They know what to expect. They know exactly what's coming. So that makes it sort of easy. We can just, do our registration, get them ready to go, do everything, put the IV in, everything that we need to do. And there's no anxiety about it, perhaps. But even those it's not routine per se, because you're still looking after a person and you want to take good care of them. And, they have family who are at home or waiting outside for them to finish, who, are anxious for them. So it's never... As much as there's some routine to it, it's an important job, and that importance should not ever be forgotten.
Last question, and I ask this to all my guests. In my business, I talk about the power of doing our imperfect best, and what it means to me is we get a vision of the best we want to create in our lives and for the people around us. And as we go for it, imperfections come up, mistakes come up, uncertainties come up, and in the way I see it, instead of using those things as reasons to stop, we learn from all of it and move back toward the best we envision. What does doing your imperfect best mean to you, Rachel Lindquist, RN?
Hmm. To me, it's reconciling that every shift, every day that I go in, and even at certain parts through the shift, there's always, I want my care to be up here. I want it to be the best care it can possibly be. But then maybe in the morning when I have, there's no chaos yet, things are very chill still, I can focus in on doing this amazing whatever it is I'm doing. But then as things go along, things get more chaotic, things get busier. You're doing the best you can, even though in your head you're beating yourself up because you know you can do better. Like, you know that this is not the optimal care that I'm providing. That's frustrating. It's so frustrating to know that the care that you're providing somebody is not as good as it could be if you had more resources, if you had more staff, if you had fewer patients to look after, that you wish you could do better. So I think it's sort of doing my imperfect best is realizing that not everything is in my control. And it just do the best I can, give the best care I'm capable of giving under these circumstances.
Hmm.
And you just
That's
kind
a
of,
powerful.
sorry,
That's a powerful definition.
is it?
Thank you. Well, good to see you, my friend.
Yes.
Thanks for all you're doing, and thanks for being on Awkwardly Awesome podcast.
Thanks for having me. It was fun. It was fun to talk with you.
Awesome. Oh, um, doing all these interviews is such a treat. Just got to talk for an hour with the nurse about what they do all day and the best ways to be a patient, to be a family member, and get ideas on that. It's all so good. Th- Thanks much for tuning in today. Whether you're watching this live or on a replay, and please comment if you have comments. We love them. And I'll have another guest next week at the same time. So please tune in then. Until then, have a great week. Thanks for being you. Never stop. Someday I'm going to stop it on time. It's not today. Well, have a great week. Bye.